one of the challenges that happens is that systems are looked at as very linear, and patient experience, it's not linear at all.
Welcome to the Business of Healthcare podcast from the Center for Healthcare Leadership and Management. The center is based at the Naveen Jindal School of Management at the University of Texas at Dallas. The show, like the center, brings together business leaders and other forward thinkers to discuss how best to meet the challenges of a rapidly changing, increasingly complex healthcare industry. I'm your host, Dr. Bob Kaiser, Director of the Master's Program in Healthcare Leadership and Management for Professionals. This episode takes us to Portland, Oregon to engage with author, speaker, co-founder, and CEO at Emerge Interactive, a digital product agency that helps clients to transform from current state to future state, innovating their customer experience and increasing productivity. Please join me in welcoming Jonathon Hensley to the Business of Healthcare podcast. Welcome to the podcast, Jonathon.
Thank you so much for having me, Bob.
All right. Well, we have a lot of things to try to cover today. Let's start off with a little bit of your background and move into what the company does and then get on some of these interesting topics. I know this by a little research that this is hard to say. You've been in business 20 years, and not too long ago, you were recognized as one of the entrepreneurs, one of the top 40 under 40 in Portland. So that means you had to start probably in the 7th or 8th grade, best I can tell.
That's about right. That sounds about right. It was an early start for sure. But I was lucky. I got early access to technology growing up in Silicon Valley and a wonderful upbringing in the healthcare space with my mother being a doctor.
Oh, excellent. I didn't know that about you. So thanks for sharing that. So tell us a little bit about the company and the things that you are focusing on right now.
Yeah, so we at Emerge, we started a company because we really recognized the problem of gathering insight that's necessary to build successful digital products and services. So what we do is clients bring us in to really focus on designing and delivering those digital products. So that might be your website, a mobile application, an internal business tool, something that is really going to help you move your organization forward. And that's where we focus. So we're helping develop the strategies and taking that all the way through design and development to support the needs of our clients.
So is this predicated on building a digital business model for these companies?
Many times we have clients in both spheres. We have traditional businesses that are augmenting what they do today with digital technology and looking at how they amplify or extend their service offering through technology. And then we have clients that are, the entire organization is built around digital products and services and looking at how they can continue to innovate and disrupt the markets that they serve.
So what's the engagement process for this? Do you start at the top? Do you work your way up from the bottom? What's involved in getting people to think differently and really embracing organizational change in times of uncertainty?
Well, it really depends on the size of the organization. I mean, we work from senior leadership in the C-suite all the way down to product management level in an organization. At the end of the day, all of our customers are the same, that they're digital product owners. They're executives and leaders that are leading these initiatives. And that might come from somebody sitting in as a CEO of an organization. It might mean that you're a VP of marketing. It might mean you're head of operations or in charge of patient experience. As an example. So we always start with a kind of a fundamental thing, no matter who we work with, though, which is getting extremely clear on what problem are we solving? What are the obstacles to solving that problem? And how do we develop a coherent strategy and approach to helping them overcome those obstacles with the resources that they have so that we can deliver a great product or service for them and help them engage customers and patients differently.
Well, you're hitting on something that I think is probably one of the most important trends nowadays is what I call the customer experience, CX, or the patient experience in healthcare, and finding ways to better understand their needs and communicate with them. So what's involved with that? I'm sure that education is a key component of what you do.
Education is. I mean, we are not an educational organization per se, but it's a byproduct of our process. And so a lot of times, as an example, we will come in and we are trying to help them develop a common language. So in healthcare, there's a whole series of acronyms and shorthand that caregivers and providers and administration is using all the time. And we have to unpack those. Now, it's one thing to have the terminology. It's another thing to have a shared understanding of that terminology. So when one person says patient experience, do the other people in the organization understand patient experience to mean the same thing? And in many cases, we see that to be very, very different. Or it's within the context of maybe a siloed function of the organization. And so what we have to do is we really try to help unify that understanding so that an organization can effectively deliver and, most importantly, can accelerate and do more with less as they go forward.
When you have a great experience, we get surveyed all the time. Every time you buy something or you do something online, usually within about 10 seconds, there's some type of survey to provide feedback. And very few people take the time, to send that feedback. Feedback's a very important gift. And when I experience something that just flowed so nicely and works so well, I really become a raving fan. And I tell people about it. I say, wow, I can't believe how they took care of us. I didn't have to be put on hold 5 times and be transferred around, etc. I order some supplies from one company and they know it's me. They say, hello, Bob, right away. And they know what I bought from them the last time. And I'm going, wow, that's incredible. How do you get something like that invoked into somebody's website? Because a lot of stuff I see on websites still, it's more about what they are and it's more about them. And it's not about the why they're doing this, and it's not about me. So how do you get people to change their thought process on marketing?
Well, I think that's a great question. And I think fundamentally what we start with is we have to ask ourselves a question of what is the job of the website? What does the job need to do? And just a simple question like that can start to transform the conversation. We go from, we need people to just know about our organization, or we need them to do what? And then we start prompting stakeholders in these types of things. And they start to say, well, wait a minute, I need somebody to be able to physicians. I need to be able to say, is a physician available? Do they accept my insurance? Do they have the specialties that I need? I need to be able to navigate to the ER in a case of an emergency quickly. How do I get access to the right information at the right time? How do I now access my chart if you're using Epic as your EMR? How are you looking at the different ways of bill pay or self-service and telehealth now and all of these different things? All of a sudden you realize the website is not a marketing website. It's a product. It's an essential component of how you deliver, services and care to the community and to your patients. And not only to the patients, but we have to also recognize in that a huge part of our audience are going to be family members who are caring for those people. And we also have potential, nurses and doctors who are evaluating joining those teams. So with that shift, we have a significant change in how we look at that.
Well, I can tell you the experience, when it works very smoothly, it, when you start to see your ability to do self-servicing and to get engaged, I think it's the efficiency factor goes up way high. I know that if you have to go see, we have a lot of hospitals and, healthcare facilities here in the Dallas-Fort Worth area where we're based at University of Texas, Dallas. And if you go in and watch this process take place, when it is streamlined, it's incredible. They have pre-check-ins. They've got everything tagged. Everything is closely monitored. They even send you a text to go pick your car up out of valet. They know when you're through with your visit. I mean, very, very self-service model in a lot of respects. And I'm sure that it really frees up a lot of the other people inside, the internal resources. They've got the power to deal with us in a way that is meaningful. And quite honestly, it feels a little bit like they're empathetic. They have empathy for us. They actually care for us. They have the time to care for us. So I'm glad to see that taking place. We can do so much better, I think, than what we've tried to do in the past here. And we need some innovation to make that happen. So tell me more about Epic. And it's a pretty popular electronic health record. It's pretty dominant in this neck of the woods. What are you doing with Epic and how are you making, that a better environment for everybody?
So one of the things that we've done at Emerge is with Epic and other similar systems that handle electronic medical records and providing other services for hospitals and institutions, is one of the challenges that these organizations face is dealing with how do I create a unified patient experience? How do I not have patients going in 10 different directions trying to get to the information they need? And so this goes back just to what you're just describing, Bob, about really making sure that I have this fluid, natural experience that supports me at every stage of my healthcare journey, meaning that I'm looking at, what is it like when I arrive there? What is it like when I'm in my appointment, follow up to the appointment, the time, the space and time between the follow-up appointment. And so one of the challenges that happens is that systems are looked at as very linear, and patient experience, it's not linear at all. We have little tasks, we have moments that we go through that make up our experience that you might be able to look at linear. But the process of healing is not. It's a system. It's a cycle that we go through. And we need to design our experiences, and we need to design our processes going forward. More think about that continuous trip around the circle that we're taking. I did some work many years ago with a cancer institute. And, you look at the process of a child who has cancer and what they're going through, there's nothing linear about that process. The fact that you first have a child who maybe is sick and they're hurting, you don't understand why. A few weeks go by, the parents decide this isn't right. They're not getting better. Let's take them to their pediatrician. The pediatrician says, yeah, we're going to send them to a specialist. Now, all of a sudden, we're already 3 or 4 weeks in, we've got 5 appointments in, and we don't even know that we have cancer yet. You're running through the circle. And when we talk about empathy and we talk about these systems that need to be more aware of that process and that cycle, we are embracing empathy in such a way to understand, well, this potentially little girl's mother and father are having to get time off of work to do these appointments. Maybe there's siblings that have to be taken care of, and childcare, and all of these things that are actually components of the healthcare experience. And so when we think about empathy, we're inclusive. It is the ultimate inclusivity of understanding what it's like to be in that situation. And it's less about efficiency. We get there. We get to efficiency, but empathy is proven to actually help organizations make more money, be more profitable, and more efficient. We're not always doing it, so we have a lot of waste. And so by doing right by patients with that kind of thinking, we can, as an organization, innovate and do much, much better.
This episode is brought to you by the Center for Healthcare Leadership and Management, the definitive resource for healthcare management education in North Texas. The center is based in the Naveen Jindal School of Management at the University of Texas at Dallas. It plays a unique role in training the next generation of healthcare leaders to meet local, regional, and national demands. The Jindal School uses its strengths in accounting, administration, finance, marketing, and information systems to educate highly qualified personnel for healthcare administration and executive leadership positions. The center is home to 7 healthcare leadership and management programs, including undergraduate and graduate programs, as well as executive programs for physicians and working professionals. For more information, visit us online at jindal.utdallas.edu/healthcare.
Recently I reposted a LinkedIn post that Dr. Marty McCary did. He's with Johns Hopkins, and he had a TED Talk that he posted, and his whole talk was centered about rebuilding trust and care into our healthcare system, because we get distracted as physicians and healthcare professionals doing all the busy stuff, and we don't put enough attention to the concept of trust and to care. I think that care should be, a key component of what we are doing. How do you see that in the industry, Jonathon?
Well, I agree with you. I mean, another person who completely reinforces that point of view is Adrienne Boise. She's the Chief Experience Officer at the Cleveland Clinic, and she did a TED Talk about how empathy can help us, can heal healthcare. This idea that empathy is not a soft skill, but an essential hard skill, and that it's proven to improve health outcomes. So I think when we look at building trust and thinking about moving organizations forward, we have to really I go back to something I said earlier, which is we have to have a common understanding, a source of truth of what patient experience is, what it's made up of, how it works into our systems. And once we really map it, we can identify areas of opportunity to innovate and improve. And so many organizations have never truly mapped the patient experience, or they've never really mapped the technology and the ecosystem behind that experience and the people and how they interact. And so we look at things in very siloed functions, which is great to compartmentalize and keep it all organized. But it's a really horrible way to look at innovation and to improve processes, because everything is interdependent upon one another. So if we really can look at that, and we all of a sudden we bring this incredible amount of knowledge from all these different people over the organization, and we bring it to the surface so everybody can be a participant in innovation. And when we talk about the transformation, it's that cross-functional participation that is usually the make or break of whether or not an initiative is successful to begin with.
So on occasion, we talk about agile management methodology, where you get the teams on a smaller scale to collaborate and really have a persistent focus on the business value and the appropriate level of quality to make improvements. And we see that in small groups. What about at the top of the house? What's your experience with the top leadership? How do you get them involved? And how do you get it to a point where you can have leadership without authority, getting everybody centered on that concept of care?
Well, I think, we're agile, on the technology side and on the management side, from my experience, where it breaks down is when leadership has not provided a clear and cohesive vision and strategy for the organization. So the ability to work quickly and iteratively, and the entire idea behind agile management and the concept of these smaller teams, they're not set up for success unless leadership has done their job. And so what happens a lot is goals, ambition, hard work, forecasting, all of these things that are really, they're not strategy. Like planning is not strategy. How we think about deploying our resources and with across a scope of time to accomplish a goal, that's planning, but that's not strategy. Strategy is being extremely clear on a couple of critical things. Where do we want to be as an organization? What's that destination or true North Star? What are the problem that we're seeing for our patients or our customers? And what does that need to look like? What's the near-term outcome for patients and the near-term outcome for our organization to move us forward to that vision? And then how are we going to measure progress? If those kinds of things aren't in place by leadership, the organization does not have the information they need to effectively drive a lot of these initiatives. And so they take way longer than they need to. Their cumbersome processes, and agile then can be a crutch because they haven't been empowered with the information necessary to actually execute effectively through an agile workflow.
Well, we can't escape the situation that we're all in right now, the environment of this pandemic. It's forced a lot of changes. At the university, we're delivering our classes primarily in a virtual classroom, which is uncommon for a lot of, outstanding universities. That's not their preferred method. But we're doing that, and that filters down in the way we buy things and shop for things. And it has certainly made an impact on what we like to call virtual healthcare or telehealth. And so in a situation like this, I think we've been forced to innovate and to adopt things that we might normally do. Healthcare providers in general, are they well prepared for crisis situations like this? And if they aren't, what's the process to take advantage of this time to get better prepared for the future?
I think that's a hard question to answer, but I'm going to do my best.
Okay.
In the fact that I think that healthcare professionals are actually some of the resilient and capable people of managing crisis and change because of the nature of what they do and the type of people that enter that field. I have yet to ever meet somebody in healthcare who's not incredibly intelligent, passionate, smart, dedicated, willing to put in the extra time to care for others, whether it's their colleagues or the end patient, support, the organization that they're working in. And I think that they're an incredible body of individuals that make up the healthcare space. What I also think is a challenge, though, that they have to embrace, especially the leadership side of healthcare, is again goes back to empathy. And why empathy is so important in this case is that these incredibly smart, well-intended individuals have bias. Cognitive bias is something that everybody deals with. And by stepping into other people's shoes, we have to step away from our biases and how we think it should be. We need to step into the shoes of our patients. And in a moment of crisis, your ability to pivot is about how quickly you can shift out of your lens and into somebody else's so you can see the total picture. And great leadership is always about being able to assess what's happening from every angle, and sometimes with very little information, but having that bigger picture perspective and then being able to make decisions. And empathy is an incredible tool to do that. The other thing that it does is it removes another common attribute, which is called confirmation bias. So this idea behind confirmation bias is that we seek out information that validates the way that we look at the world or look at a situation or a problem. And we need to step away from that. And so that you can see that really clearly too. If you just go and look at, let's say, a dozen hospital websites, they all start to look kind of all the same. And there's certain things about that that's totally okay. But what we see is there's market bias because everybody goes, well, if this institution did it, it must be a best practice. They must be doing it right. And come to find out they never did anything different than you're doing. They just happen to be able to get with it because they're a premier brand or they've got, kind of the right stuff. It doesn't mean the results are any better. And so those types of things are really holding organizations back. And I think when there's crisis, the ability to jump out of your shoes and into somebody else as fast as you can so you can be thoughtful in your decisions and have the right information is mission critical. And that's why I say that. I think physicians and administrators in healthcare are so incredibly primed to be leaders in managing crisis. But they need to learn some of these other critical skills and they need to understand a little bit more about technology in order to do that in this current scape.
Yeah, physician burnout and healthcare professionals, they all are subject to burnout. And you look at some of the administrative things that they are asked to do, they don't really get to operate at the top of their license. They're really the benefit of having new processes and new technologies. And I think part of the situation now is that we're being forced to go down that path and really look at it and say, yep, it's not that bad. We can go to a hospital here and put everything into my chart, and you get to the hospital and they go, fill out these forms. And you say, hey, I did all this on my chart. And they look at you and they say, you did? No, hardly anybody will do it, So the patients as well need to be educated and everybody gets synced into this whole thing. So let's take the last few minutes here of this podcast and talk about some of the cool stuff, the cool technology things that you've seen implemented. There's a term called wayfinding, and I'm sure not everybody knows what that is and how that's applied, but tell us a little bit about some of the technology benefits that you've seen in improving workflow process and the care process.
Sure. So wayfinding is something I think is incredibly exciting, both for patients and for healthcare workers. It's the concept behind it, just for our audience, so everybody knows, is the ability is that a lot of times these campuses are large, they're complex to where you should be, where you can't be, how to navigate them effectively. And through wayfinding on, let's say, your mobile phone, you can navigate point by point with directions. Just like if you were using Google Maps, but with extremely pinpoint accuracy, so you can be indoors. So you can be moving around a building from floor to floor or space to space effectively. And so an example of that might be I'm reminded on my phone that I have an appointment coming up and traffic means that I need to leave a few minutes early for that appointment. And then I get within proximity of the hospital and they say, hey, don't forget, we have valet parking. Pull up here and we'll, help you, park your car, or this garage has available space. Come to us. And then you get out of your car and then it gives you turn by turn directions of how to walk across that campus, enter the building, check in, and go directly to where you need to be for your appointment.
How cool is that? That is really cool.
It's incredible technology. It's beautiful. And there's a really powerful component to it for organizations as well. Beyond delivering great experiences, they have information where they can start to say, is this part of our building being used? Could we optimize that to be a little bit more effective? We're seeing that there's a bottleneck, a check-in at this time, every day. Why is that happening? Let's look at that. Let's create a better experience. Let's create better flow so there's less delayed appointments. And now we are making better use of employee, and staff time. There's so many benefits to that kind of technology because now we have data that is still anonymous and we protect the rights and privileges of individuals, but it gives us insight to deliver better care. And I think those kinds of technologies are just incredible. And so we've been working on for the last 5 years in some of that innovative technology and what's happening there. It's been really exciting.
What about the Internet of Things? Anything cool that you see like that going on there?
Oh, absolutely. There's everything from, what Apple has done with their health kit and supporting research and learning more about diabetes. There's the ability to provide self-care and information or post-acute care or chronic care in the home because you have now sensors inside of devices where you can send information directly through those devices to your providers. I think the scope of that space is just endless. And I think we've only just barely scratched the surface of what's really possible. And again, most of that is very fragmented right now. They're kind of individual use cases and individual providers for a lot of these things. I think over time, you're going to start to see more and more of that become unified so that you have that total, complete life experience with your healthcare providers in your community. I see that manually get done. I think a really good example is when my son was born, we still have connections to that physician here 7 years later. That's all manual. There's ways to automate that to bring more nurturing and critical information into that process of something where being a new parent is a crazy experience, and anybody listening who's a parent can probably relate. It's there's no manual for it. So I think technology can be a huge enabler of so many facets that are just barely being touched right now. But I think it's incredible to see.
Well, it's been a pleasure spending some time with you. It's really good to hear about Emerge Interactive and that you guys are truly at the epicenter of digital transformation. And you're really focused on the customer experience, the employee engagement, and also this whole new platform of digital delivery. So, Jonathon Hensley, thank you for joining us. We're going to keep an eye on you and follow you, and hopefully you'll do the same with us.
Absolutely. Thank you so much for having me, Bob.
It's been our pleasure. Thank you. Thanks for listening to the Business of Healthcare podcast. Join us online at businessofhealthcarepodcast.com to find episode links, notes, and more. Be sure to subscribe to the Business of Healthcare podcast on Apple Podcasts or your favorite podcasting app. To learn more about the Center for Healthcare Leadership and Management, go to jundal.utdallas.edu and then search under the Center and Institutes tab on the navigation menu. Also, we want to hear from you. If you'd like to provide feedback, make suggestions for future guests or show topics, or just want to get in touch with us, email us at healthcarebizpodcast@utdallas.edu. Biz is spelled B-I-Z. And let us know how we're doing. I'm your host, Dr. Bob Kaiser, with the Center for Healthcare Leadership and Management, where we're leading change by changing how we lead.